have the Bihar state paper, Dr. Pratik. Dr. Chaya bhi aa gayi hai.
ठीक है, प्रेजेंट कर रहा हूँ। बिहार
This is the Bihar state.
ये तो
Good afternoon, esteemed panel and respected audience. Clinical angiographic comparison of retinal findings and a new classification system for hypertensive retinopathy. I have no financial disclosures. So hypertension is one of the most common systemic diseases, a marker for preclinical comorbidities, and about half of all retinal vascular occlusions are attributable to uncomplicated, uncontrolled hypertension. Existing classification systems for hypertensive retinopathy have their own limitations, including not including retinal vascular occlusions into any of the grades of the hypertension. The aim of the present study was to determine the clinical profile of patients with retinal vasculopathy in hypertension, with special emphasis on retinal vascular occlusions and patterns of angiographic changes. So this was a cross-sectional study at a tertiary teaching hospital approved by the Institutional Ethics Committee. Comorbidities were excluded on the basis of routine investigations, and the patients were treated as per standard protocol. Hypertension was defined as per the AHA-SA criteria, and these are the eligibility criteria. So less than 60 years old hypertensive patients with any grade of hypertensive retinopathy were included, and various comorbidity were excluded on the basis of internist referral and routine investigations. The BP was measured according to the WHO ISH criterion, and all photographs, including fundus photographs and FFAs, were evaluated by a single experienced examiner blind to the ophthalmoscopic findings. Sequential monocular photographs of the worst eye were taken as part of the FFA. So 40 patients of uncontrolled hypertension and 80 eyes with hypertensive retinopathy were included, and other comorbidities were excluded as they could modify the retinal hypertensive changes. And just the 30 males and 10 females were included, mostly in the age group of 45 to 49 years. Most presented with hypertensive crisis, which was controlled, and then the investigations were undertaken. Most were on irregular treatment. Arteriovenous changes were noted in up to 40% of the eyes. The background retinal changes were noted, and hemorrhages were the most common background retinal changes. These are some of the representative photographs from the study. 10 eyes of 9 patients presented with retinal vascular occlusions on a background of hypertensive retinopathy, and these rates are consistent among the subjects of hypertension seen in various studies across the globe. BRVO was the most common retinal vascular occlusion noted. These are some of the representative findings from the cases. In particular, this case presented with bilateral old STBRVO with neovascularization and had to be intervened with aggressive systemic control, intravitreal anti-VEGF, and bilateral sectoral laser. Cardiovascular complications were the most common systemic complications noted, and again the hemorrhages were the most common systemic, the retinal findings in these systemic complications. FFA was poorer at detecting hard exudates and macular star configurations, but better at detecting capillary bed changes, including non-perfusion, leakage, microaneurysms, and shunt vessels. So few differences were noted in clinically relevant findings, especially regarding capillary bed changes, which is similar to previous studies. It is known that retinal vascular occlusion is a risk factor for neovascularization and may be identifiable only by angiography. In our patients, we found considerable overlap between the grades of hypertensive retinopathy when the angiographic findings are considered alongside the clinical findings. Existing classification systems are basically based on studies which include patients with multiple comorbidities whose effect is statistically corrected. The literature contains very few reports of proliferative retinopathy and hypertension, but it is not included in the grading of hypertension. Again, the use of the term malignant hypertensive retinopathy is a misnomer. Cases of mild and moderate hypertension were also found to suffer from retinal vascular occlusions and needed additional ocular treatments in our case, in our study. Patients with very few hemorrhages have no added risk of vision loss and may benefit from systemic control alone, whereas with vascular occlusions, there is risk of vision loss, stroke-related morbidity, and risk to life. With prolonged vascular stress and ischemia, this condition may also be bilateral, as we just shown. So this is based on the expert opinion that the new suggested system of hypertensive retinopathy includes retinal vascular occlusions in a background of hypertensive fundus with or without neovascularization, without obvious neovascularization, with subclinical angiographically detected neovascularization, and with clinical NVD or NVE with the same definitions as is consistent with the routine definition of NVD and NVE. And then you have occult RVOs with neovascularization. High-risk hypertensive retinopathy is when all of this is very severe and associated with systemic complications. This study is not without limitations, especially because it has a very small sample size and FFA is performed uniocularly. So 1/4 of subjects of hypertensive eye disease present with retinal vascular complications. Thank you.
Thank you, doctor, for a very interesting